There's this question which says, how mentally and physically healthy will be the child if conceived after 35 years of age?
Okay, so 35 years of age, when we come to the child, let's begin with the mother first, or the lady who's planning to have a baby. So whenever we get a patient who's coming at 35, we do something which is called as a preconceptional counseling, where we talk to her about a lot of things and investigate about different things. 35, we have to first consider how fertile she is. So obviously we get the AMH done, which we have already spoken about in length. We do a sonography where we find out how many follicles will be recruited in a cycle, which can then later on lead to a pregnancy. We get the husband's semen analysis. After that, a series of blood investigations, which include a thyroid level, basically pointing out to the thyroid level, her blood sugars, and a lipid profile. So these things become important. At 35, we have to understand two things. First, her age related leading to some pregnancy complications, and her age related to some fetal complications. So per se, in pregnancy complications, we have to understand the fact that she might be a little more prone to getting diabetes or a high blood pressure during pregnancy. So these things have to be taken into concern, and the patient should also understand this. Secondly, when it comes to the fetal part, we have to understand that at 35, we have to understand that there is something which is called as a chromosomal abnormality, which can happen for the fetus or for the baby, which can happen. So with age, the risk of a baby or risk of a fetus getting chromosomal abnormality increase with particular ratios. So that becomes important. The patient has to understand that her having a baby at 35 can lead to Down syndrome or some mental subnormalities which can affect the baby. For that, we have various number of tests which are available currently. There's something which we have, which is called as a NIPT, the non-invasive pregnancy test, prenatal test, where we find out these chromosomal issues very early at around 9 to 10. Apart from that, we have serial sonographies which are done, serial blood investigations which are done over the entire pregnancy, which can pinpoint the mental issues per se, since it's come to that, basically pinpoint some chromosomal abnormalities which can happen to the baby. Again, said and done, in the general scenario, if that pregnancy is complicated with blood pressure or with diabetes and with any other issues related to the age, there are chances that the mother can have a preterm delivery. So she has to be warned for all these factors also.